Health authorities and maritime logistics experts are shifting their focus to a developing public health concern as reports emerge regarding the potential transcontinental movement of hantaviruses. The recent alert, centered on the vulnerability of European ports, highlights a critical intersection between global trade and zoonotic disease surveillance. Hantaviruses represent a family of viruses spread mainly by rodents, and while they are not a new phenomenon, the prospect of these pathogens crossing the ocean in a significant or novel way has prompted a reassessment of current biosecurity measures. For viewers and policymakers alike, the concern is rooted in the high morbidity associated with hantavirus infections and the logistical difficulty of monitoring mobile rodent reservoirs within the mass scale of international shipping. Historically, hantaviruses have been categorized by their geographic distribution and the specific rodent species that carry them. In Europe and Asia, the viruses typically cause hemorrhagic fever with renal syndrome, or HFRS, while in the Americas they are more commonly associated with hantavirus pulmonary syndrome, or HPS. The headline of a global threat suggests that the traditional geographic boundaries of these viral strains may be under pressure, potentially due to the efficiency of modern shipping networks. To understand the gravity of the situation, one must look at the biological mechanism of the virus. Hantavirus is not typically spread from person to person. Instead, it is an environmentally acquired infection. The virus is shed in the saliva, urine, and feces of infected rodents. Humans become infected primarily through the inhalation of aerosolized viral particles. This occurs when dried rodent waste is disturbed, sending microscopic droplets into the air. In the context of a busy European port, where thousands of shipping containers are processed daily, the presence of an infected rodent population within a closed cargo environment presents a specific type of risk. If a virus strain native to one continent is introduced to the rodent population of another, or if humans are exposed to imported viral strains in a port setting, the public health implications could be substantial. This framing of the situation as a worst-case scenario for European ports indicates that surveillance agencies are no longer treating the issue as a localized problem, but as a systemic vulnerability in the global supply chain. The timeframe for these concerns is immediate, as port authorities begin to review their rodent control and health screening protocols to mitigate any potential crossover of these dangerous pathogens. The core developments surrounding this alert focus on the specific actions taken by port agencies, medical laboratories, and international trade regulators. The mention of European ports preparing for a worst-case scenario points to an escalation in surveillance activities that move beyond standard pest control. In major maritime hubs, health officials are reportedly intensifying their monitoring of incoming cargo, particularly shipments originating from regions where hantavirus is endemic. The logistics of this task are immense, as port environments provide ample hiding places for rodents in warehouses, ship holds, and container yards. Public health agencies are currently examining the protocols for testing and isolation should a suspected case arise among port workers or sailors. Lab and testing angles are central to this development, as identifying the specific strain of hantavirus is crucial for determining the level of risk. Clinical laboratories are being advised to maintain a high index of suspicion for patients presenting with sudden onset fever, muscle aches, and respiratory or renal distress, particularly if the individual has a history of working in shipping or logistics. One of the primary challenges identified by officials is the disparity between verified information and the logistical realities of global trade. While there are strict regulations regarding the sanitization of shipping containers, the sheer volume of trade makes 100% compliance difficult to verify. Furthermore, the source material suggests that the crossing of the ocean by the virus may represent a shift in how these pathogens are tracked. In the past, hantavirus was often viewed as a rural or wilderness risk, associated with barns, sheds, or forest cabins. However, the current focus on ports shifts the narrative to an industrial and urban setting. Officials are weighing the impact of enhanced inspections on shipping times against the potential cost of a localized outbreak. Statements from health departments emphasize that while the risk to the general public remains low, The potential for worst-case disruptions to trade and port operations is a driver for these preemptive measures. There is an ongoing effort to contrast the sensational nature of global threat claims with the data-driven reality of virological surveillance. Research into how long hantaviruses can survive in the environment, specifically within the microclimates of shipping containers, is a priority for labs tasked with assessing these risks. Current evidence suggests that while the virus is relatively fragile outside of a host, it can remain infectious for several days under the right conditions, making the transoceanic voyage a viable, if difficult, pathway for the pathogen. Prevention and surveillance remain the primary tools for managing the threat of hantavirus in both port settings and the wider community. Public guidance issued by health authorities focuses heavily on rodent exclusion and the safe cleaning of areas where rodents may have been present. For workers in high-risk environments like European ports, the use of personal protective equipment, such as N95 respirators and gloves, is recommended when handling materials that could be contaminated. The core of prevention is a clear understanding of aerosolization. Individuals are warned never to sweep or vacuum rodent droppings, as this action kicks the virus into the air where it can be inhaled. Instead, the use of disinfectants or bleach solutions to saturate the area before cleaning is the standard procedure. Surveillance of rodent populations in and around ports is also being ramped up. This involves trapping and testing local rodents to ensure that foreign strains have not established a foothold in the local ecosystem. Despite these proactive steps, there are significant limits to current knowledge. Public health officials remain uncertain about the exact frequency with which hantaviruses hitchhike on international cargo, and the degree to which climate change or shifting trade routes might influence rodent behaviour and viral prevalence. There is also no specific vaccine or cure for hantavirus infection, which makes early detection and supportive care in a hospital setting the only viable medical response. This lack of a targeted treatment underlines why the worst-case scenario planning in European ports is so focused on prevention and early warning systems. As the situation evolves, the focus will likely remain on the intersection of veterinary science, maritime logistics, and clinical medicine. The goal is to create a multi-layered defense that prevents a zoonotic spillover event from becoming a broader public health crisis. While the news of a global threat can be alarming, officials maintain that a calm, science-based approach to surveillance and sanitation is the most effective way to manage the risk. For more updates on global health reporting and surveillance developments, consider subscribing to this channel. The core developments surrounding the recent alerts in European maritime hubs focus on a sophisticated intersection of infectious disease surveillance and global logistics. As agencies prepare for what has been termed a worst-case scenario, the primary concern revolves around the potential for hantavirus strains to bridge geographic divides through the modern shipping container system. This mechanism of ocean crossing represents a significant challenge for port health authorities, as the virus does not travel via human carriers, but rather through its rodent hosts, which are adept at infiltrating cargo and surviving long-duration voyages. In this context, the development of robust biosecurity protocols is paramount. Port agencies are currently tasked with intensifying their oversight of high-traffic zones where rodents, specifically species within the Muridae family, such as the brown rat or the house mouse, frequently congregate. These animals serve as the primary reservoirs for various hantaviruses, including those that cause hemorrhagic fever with renal syndrome or H5S. When these rodents enter shipping containers or the holds of bulk carriers, they can inadvertently transport the virus across the Atlantic or from the Pacific directly into European ports. The logistics of the worst-case scenario involve a situation where a non-endemic, highly virulent strain is introduced into a local rodent population, or where a cluster of human infections occurs among the port's labour force, potentially triggering a shutdown of critical trade infrastructure. Central to these developments are the clinical laboratories and diagnostic centres that operate as the front line of viral identification. In a standard public health response, these facilities utilise specialised testing methods such as enzyme-linked immunosorbent assays or ELISA to detect the presence of hantavirus-specific IgM and IgG antibodies in suspected cases. Furthermore, molecular techniques like reverse transcription polymerase chain reaction, or RT-PCR, allow scientists to sequence the viral RNA, providing definitive proof of whether a detected strain is a local variant or an imported pathogen. This distinction is critical for epidemiologists who must determine the source of an outbreak and the likely trajectory of its spread. The source material's emphasis on a global threat suggests a heightened state of readiness within these labs, which must differentiate between the relatively common European Pumala or Dobrava-Belgrade viruses and more severe strains typically found in other hemispheres, such as the Sin Nombre virus. The pressure on these institutions is immense, as the accuracy of their reporting directly informs whether port operations can continue or if strict quarantine measures must be enacted in the realm of international trade and shipping. The alert has sparked a reassessment of current sanitization standards. While shipping companies often implement pest control measures, the sheer volume of global commerce, moving millions of TEUs or 20-foot equivalent units annually, makes comprehensive monitoring a logistical ordeal. Trade officials are currently weighing the verified data against the alarming claims of a transoceanic viral threat. Historically, hantaviruses have been localized, but the efficiency of modern shipping provides a unique conduit for viral transit that was previously less common. The contrast between official statements and the verified reality remains a focal point for investigators. While some reports indicate a looming crisis, health agencies typically emphasize that the actual risk of human infection remains statistically low, provided that strict environmental controls are maintained. The tension exists between the economic necessity of moving goods quickly and the public health necessity of conducting thorough inspections. For hospitals situated near major port cities, this means preparing for patients who may present with atypical symptoms for the region, requiring specialized isolation units and high-level supportive care until a definitive diagnosis can be made. These developments underscore a shift in global health strategy, where the focus is no longer just on human travelers, but on the invisible biological cargo that hitches a ride on the vessels powering the global economy. Prevention in the context of a potential transcontinental hantavirus spread begins with a rigorous adherence to established public health protocols designed to interrupt the primary transmission route, the inhalation of aerosolized viral particles. For personnel operating within European shipping corridors or those living in proximity to large-scale logistics hubs, the most effective practical takeaway is the wet cleaning method. Public health agencies strictly advise against dry sweeping or vacuuming in areas where rodent activity is suspected, as these actions disturb dried urine, saliva, and droppings, lofting the virus into the breathing zone of humans. Instead, the standard guidance is to saturate contaminated surfaces with a disinfectant, ideally a 10% bleach solution, for at least 5 minutes before wiping the area down with paper towels. This chemical deactivation is a critical line of defense in port warehouses and container yards where long-term rodent residency may have occurred. Furthermore, the use of personal protective equipment, specifically N95 or higher-rated respirators and non-porous gloves, is becoming a mandatory standard for workers tasked with inspecting or cleaning high-risk cargo. By maintaining these barriers, the risk of a zoonotic spillover event can be significantly reduced even if infected rodents have successfully crossed the ocean from a surveillance standpoint. The preparation for a worst-case scenario necessitates an expansion of the One Health framework, which integrates veterinary, environmental, and human health monitoring. Surveillance teams in major ports are reportedly enhancing their biological sampling of local rodent populations to ensure that any introduced foreign strains are identified before they can establish a permanent presence in the local ecosystem. This involves the deployment of sentinel traps and the subsequent laboratory analysis of tissue and serum samples. In an industrial setting, environmental management is the most sustainable form of prevention. This includes the rodent proofing of structures by sealing all entries larger than 1/4 of an inch, managing waste to eliminate food sources, and maintaining a clear perimeter of gravel or paved ground around storage facilities to discourage rodent nesting. These systemic measures are designed to create a hostile environment for potential carriers, thereby limiting the opportunity for the virus to move from a shipping container into the surrounding community. Public guidance also emphasizes the importance of clinical awareness, as the early symptoms of hantavirus infection, fever, severe muscle aches, and fatigue are often indistinguishable from more common respiratory illnesses. Medical officials suggest that any individual who has had recent exposure to shipping environments or rodent-infested areas and begins to experience sudden onset fever should seek immediate medical evaluation. The honest limits of current scientific knowledge, however, remain a central theme in these reports. While researchers understand the primary modes of transmission, there is still significant uncertainty regarding how long specific hantavirus strains can remain infectious within the microclimates of sealed shipping containers during long-duration sea voyages. The influence of varying humidity and temperature levels on viral stability is a subject of ongoing study, and until more definitive data is available, authorities must operate under the assumption that the virus can survive the journey. There is also the question of spillover potential. How easily a strain native to one region might adapt to the rodent reservoirs of another. These unknowns are why the worst-case framing is used by officials. It is a planning tool to ensure that the most robust possible response is ready regardless of the statistical likelihood of a widespread outbreak. In closing, the report of hantavirus potentially crossing the ocean serves as a reminder of the inherent vulnerabilities in a globalized trade network. While the situation demands heightened vigilance and improved biosecurity at ports of entry, it does not currently warrant public alarm. The ethical responsibility of health authorities and news organizations alike is to balance the need for transparency and preparedness with a calm, evidence-based perspective. By focusing on proven sanitation methods, rigorous environmental surveillance, and professional medical response, the threat of hantavirus can be managed effectively without disrupting the essential flow of global commerce. As we continue to monitor official statements and laboratory findings from European port authorities, the emphasis remains on science